In this video, we're going to go over scheduling an appointment. So we're going to enter into ECW, double click on your icon. When the application comes up, enter your username. You can press enter or click next. When it hits to this screen, wait for your username to pop up, like mine did here, before you enter your password. That'll help prevent the program from not recognizing your password. And again, you can press enter or log in. Now this does sometimes take a moment to load, depends on how busy the internet is at the time. When this box pops up, just click Open eClinical. Unfortunately, this box keeps popping up, but it actually will not let you save the password. So if you get this message pop up, click OK. You may also get a message about authentication. You can click Do Not Show Again. Now your appointment screen should look something like this. The amount of columns you have here across the top are going to be based on what we have, check marks we have marked on this left-hand side. So if we only want to see David's schedule, we can unclick all of the other options and just click David. This will show us David. If we want to see David and the blood lab schedule, we can click the both of those. If we also want to see drug testing, we can click on that as well. If we want to see everything at all, just right here at top, click all, and it's going to bring in every available appointment scheduling column. As you can see, I do have some test patients here. These are patients that were already entered into the system. Let's go over scheduling another appointment for one of these patients. So we're going to look here under David and select a time slot. We can right click and go to New Appointment. If this patient has been seen in the office before, you can search for their name up here in the bar. You just need to put in letters and 3 letters and it'll start pulling up a test. And anybody with that same last name will start appearing. The more letters you use, the more focused your search will be. I'm going to go ahead and select Test Patty. And because this is an alert screen, if there's any special circumstances on a patient, we can add a note in here that we want everybody to see that whenever they access this patient's account. For instance, if they've had trouble in the past with the wrong employer being billed or the wrong insurance being billed, we can alert other people to not send claims that way, or again, whatever. If you don't need to do anything in the screen, you could just click OK. Click Cancel. So here's the basics of the appointment window screen. This is going to default to our facility. You just leave that as is. Make sure the date is matching the date you selected on the appointment schedule and your time. The visit type, you'll use this drop-down menu here, and you can select from any of the options in the list. Let's say this patient is coming in to see David for a 30-minute follow-up visit. If you noticed by chance, this appointment time area was set from 12:30 to 12:45. When I selected a 30-minute follow-up visit, it automatically changed that to 1 o'clock, so it does automatically pull in the amount of time that is selected for that particular type of visit. In most cases, the provider is going to show up in this screen as a default. When it does not, all you do is click down here on this button and you'll have to select David. Even though Valley Medical is in there, it cannot be used as a billing provider, and it will actually prevent the system from allowing any invoices or claims to be printed. So just select David, even though in most cases his name actually isn't going to show up on the billing slip. So when those both say David, he in this case is the provider and the resource. We're going to make sure his name is in both places. This reason for visit is an optional field. You can add something into here if you want. You can create, type anything custom that you want, or you can select something from the list. For instance, if this patient wanted to come in for stomach pain, it'll give us here the option to put in stomach ache. Headache, again, it'll give you the option. There's actually quite a bit of things to select from in this list if you wanted to. You could also say patient wants to talk about medication. So you can make this reason be whatever you want. It's nice when you fill this in because on the provider views, it will show him on his schedule the reason that the patient is coming in. It'll also translate whatever you put into here as the chief complaint for that data service. And for this particular patient, since the patient was existing, that's all we need to do for an appointment. These areas are optional. When we start doing workers' comp visits, I'm not talking about things like the dot physicals, actual workers' comp visits, then this case area will come into play. But for right now, we don't need to fill that out. So when we just click OK, and I had actually already scheduled an appointment for Patty, but this normally wouldn't pop up. But I'm going to tell it, yes, I'm scheduling two patients, two appointments for Patty. And when it gets back to your screen, you now say we have this appointment here and the patient wants to talk about her medications. So it gives everybody a little hint why that person is coming in. Next, we're going to go over entering a new patient. You'll see that available in the next video.